Preimplantation genetic screening, or PGS. PGS is a technology for improving embryo selection. Since the wrong chromosome number, known as aneuploidy, is the most common cause of not getting pregnant or miscarriage, PGS allows us to avoid transferring aneuploid embryos which cannot become babies. When an embryo reaches the blastocyst stage of development, a few cells that are destined to be placental cells are removed from the embryo and sent for chromosome analysis. The embryo is frozen while awaiting the results. What are the advantages of PGS? The miscarriage rate is lower in embryos with the correct chromosome number, so the delivery rate per transfer is higher in embryos screened with PGS. Since PGS embryos are transferred during a frozen embryo transfer cycle, they are transferred into a more normal hormone environment. This may result in a higher chance of implantation, higher pregnancy rate, and a lower chance of some adverse pregnancy outcomes. A single embryo transfer of a PGS-screened embryo provides the same pregnancy rate as a double embryo transfer of two unscreened embryos, without the risk of twins. What are the disadvantages of PGS? Time. A pregnancy from a PGS cycle takes longer to achieve from stimulation start to positive pregnancy test because it consists of a fresh IVF egg retrieval cycle and a subsequent frozen embryo transfer cycle, which are approximately 2 months each. Cost. PGS adds cost due to ICSI or ICSI, hatching, biopsy, freezing, PGS testing, and the cost of a frozen embryo transfer cycle. You might have been successful with a fresh transfer without the cost and delay of PGS. And miscarriage can still happen for reasons other than aneuploidy. What are the risks of attempting PGS? There is a small chance the PGS results may be incorrect and that a healthy embryo may be discarded. The stress of the biopsy may cause an embryo to stop growing or not implant after the transfer. And there is a small chance the embryo may not survive the freezing and the thaw. Who is a candidate for doing PGS? Age. Since the likelihood of the wrong chromosome number, or aneuploidy, and miscarriage is higher the older you are, PGS may offer more advantages to older women than younger women. From a cost-benefit point of view, younger women may get the most benefit from not using PGS for a fresh transfer, but doing PGS on any additional embryos frozen to avoid paying long-term storage fees and doing futile frozen embryo transfer cycles in the future with aneuploid embryos. Recurrent pregnancy loss. Women who have recurrent miscarriages or a history of delivering a chromosomally abnormal baby can lower the risk of similar outcomes in the future by doing PGS. Repeated IVF implantation failures. PGS may help distinguish between an embryo problem and a uterine problem. Transferring embryos during a frozen cycle may improve uterine receptivity. And single embryo transfer results are generally better with PGS, especially in women older than 35. You and your physician will explore whether PGS is beneficial for your particular situation.